Acting. Oh, hey everybody, guess what? We're live. It's Monday. We're back to talk all about skin with Dr. Shouresh at Harpeth Valley Dermatology. I'm so excited because, man, I feel like we could talk about skin and skincare all day long, but you don't have all day, so we're going to get you what we have you to talk about. So you and I were just talking before we got started. So many events coming up this spring. Right now, a lot of people worried about prom and all the cotillion and all these things coming up. And so tell me, what is your best tips to get the best skin, that glowy skin that all these girls and guys and everybody wants for all these photos they're taking?
Right. So I think, there's short-term concerns and there's long-term how to look at it. So for the short run with events coming up, I think it's important to have a good cleanser. And that kind of depends on what type of skin you have, whether it's oily or dry and what season it may be. And certain cleansers can be helpful. For instance, the acidic cleanser, salicylic acid, does a wonderful job, and there's plenty of that over the counter. But glycolic acid does a phenomenal job also taking care of dark blemishes, which a lot of people have after their acne starts to resolve. So that's something to consider. But then after that, some people have very sensitive skin, so it's okay and fine to use a gentle cleanser. And there's plenty of them out there from Cetaphil and CeraVe, good hydrating gentle cleansers to use. So at the very least, we need that, ideally morning and evening if we can do that. And then moisturization in the short run is hugely important. In the long run, it provides a lot of great benefits. But in terms of having your skin glow more immediately, finding the proper moisturizer is one thing to consider. And, because you don't want to have, a lot of the products we use on our face can make us very irritated and red. And having a good moisturizer will help protect the skin so it's less prone to breaking down in the first place.
Okay. I've learned a lot, and you've only said two things basically. But tell me about moisturizers because I see so many over the counter and there's so many popular ones. What is the thing that we should look for? What type of ingredients should we look for?
Ceramides are huge. CeraVe was one of the first to come out with that, CERAVE, and ceramides are spelled the same way, CER. And so a lot of these moisturizers these days have ceramides in them now, though. So you'll find all kinds of name brands from Eucerin and Aveeno, and all of these have implemented that. But I think ceramides are key because they kind of form the building blocks to your skin. I describe it as the mortar. If your skin was like bricks and mortar, it's kind of filling in that mortar in there. But it's temporary, so it has to be something that's done somewhat regularly, whether it's one time a day, or I always say as many times a day as you can do it, because it's just good for your skin. So that's certainly one thing. I think something else to keep in mind with moisturizers, though, and this is key to be more preventative, not have breakouts, is some of the best moisturizers that can be used, let's say for your hand coming out of a dry winter here, aren't necessarily good for the face. And the reason is they can be too occlusive and they can actually break you out a little bit worse. So that's why you see these designations even over the counter where they say, facial lotion or facial cream. And that's because the word you're looking for is something called non-comedonal. Comedones are something that can develop into little bumps that can become a bigger acne flare one day. And you can have a higher risk of having that if there's too much occlusion going on. So it's important to get those facial moisturizers and lotions specifically, and maybe look for that term non-comedonal on the bottle itself.
Okay. Are there any over the counter products you recommend to your patients?
Yeah, La Roche has been one of my favorites. With moisturizers, it's tricky because some people love to just have kind of a lighter feel. Some people love having a heavier feel. Some people, as you mentioned earlier, like to have a glow, and some people don't feel too shiny with that glow. And so, it is a little bit of a personal preference. But I really like the job that La Roche Posay does. They make a great facial moisturizer that's easily available at these drugstores for a reasonable cost. And I think it does a good job moisturizing. I think we have good feedback on it feeling very good for most people. Certainly there are some of these other brands like Eucerin and CeraVe and Aveeno who make a great moisturizer as well. But I've been impressed with the way La Roche, how long it lasts and how it feels. And then the other thing is, sun protection is huge, at least more in the long run. Sometimes it can be a little trickier finding a facial moisturizer that has a sunscreen in it. And I certainly hear a lot of people who complain about their moisturizer sunscreens because they don't like the way it feels because of the sunscreen aspect of it doesn't always make it feel as good going
Right.
on. So that can be a little bit tricky. But, for that, I think, the ingredients are a little bit more important. But if you're looking for just a pure moisturizer, I think La Roche does a pretty good job.
So let's say I'm 3 weeks out from my big event. What can I do to get the optimal skin glow look? And let's talk about the things I should do, and then I want to go back and talk about the things I shouldn't do, so that
Okay.
I don't end up with a photo that I'm like, oh, I should have done that to my skin right
Yeah.
before a big event, because I've seen that happen. Tell me about a couple things we should do.
Okay, so I mean, there's the moisturizers we talked about because that's going to have more of an immediate effect. And then along those lines, there's eye creams out there, which sometimes are nice to use because they give you a little bit of a shine. Because a lot of times we look more tired or aged or whatever it may be, and the eye creams kind of do a good job of getting a little bit of pop. So having a good eye cream, I think, is valuable and can be something done in the short run to kind of get a valuable effect out of it. And then, when we're looking for a glow, as long as we have 2-3 weeks, doing things to get a little bit more attention, like a chemical peel or something like that, wouldn't be a bad idea because you do get a nice glow after that. However, to your point, that's something you shouldn't do like the day or two before because there's certain,
Right.
there's different peels out there. Some are more aggressive than others. Some can leave you very
Yeah.
irritated and very flaky. And so you want to have time to recover. But I think that would kind of help jumpstart things quite a bit, and then moisturizing really well on top of that. And then certainly if it's, somebody who's struggling maybe with acne, whether it's more bread and butter acne or hormonal acne, there are some things to consider to help alleviate that acne ahead of an event. But those are things I would at least give 2 months or so ahead of time to kind of try to take care of. Because a lot of times with acne, we can kind of settle the primary issue of getting new acne lesions, but then there's always the blemishes left behind, which can actually take a little longer sometimes to alleviate. So that's something to be, a few months in advance would be good. Um,
Mm.
and then, great things for your skin are, using like a retinol, or retinoids or prescriptions. And those are great things, but they also can be very irritating. So certainly not something you want to start 2-3 weeks before an event, but do fantastic things over many months to many years. And then I think another item that can be added is vitamin C.
I
Um,
was just going to ask about vitamin C. I had it written down.
Yeah, vitamin C. The reason vitamin C and retinols are so good for the skin is over time they build collagen. But vitamin C has some added benefits in terms of taking down blemishes. Certain products can create that glow you were asking about earlier. And it's usually not one that tends to be harsher on the skin to therefore create a drier kind of situation or something we have to worry about using even a few days before an event. So it has a little bit of a short-term benefit, but certainly a bigger long-term benefit as well.
Yeah. So, what type of vitamin C products do you recommend to your patients?
So that can be tricky. The trickiest part about vitamin C is because you'll see it over the counter and in offices like ours or any other office to be sold, and you'll see a huge price range. So, some of the brands we talked about earlier make a vitamin C cream now. And some of them just started doing that in the last 2-3 years. And they may be cheaper. They may be more along the lines of $30-$40, whereas there could be other vitamin Cs that are over $100. Um,
Mm-hmm.
come in serums, some come in lotions. The key with vitamin C is your or ascorbic acid, which is its other name that you look for on the back of a label, is there's different percentages. So certainly the higher the percentage of vitamin C, the more it may cost. But the other thing to look out for is, vitamin C breaks down very easily. And so some of the stuff that may be a little bit cheaper, the concern is you don't have much time to use it because it can only stay in that formulation for so long. And so that's why, for instance, in our office and many other offices, we sell it as a serum. And the reason we do it that way, so it's actually like a dropper. And the reason we do it that way, and we have you like drop it into your moisturizer of choice and then put it on. And that's because in that serum form, it's more stable. It doesn't break down. And so it's in its purest form and it can last quite a bit longer. So
Okay, that's good to know because I have seen those lotions you're talking about, and I didn't know that. I didn't know that they could break down. So you've saved us some money and given us some great advice. So let's talk about real quick before we go what we should not do right before a big event that could cause that irritation and things we don't want to deal with
Right.
before a big night out. Or
Right, right. So the retinols and retinoids that I talked about before, again, much better long-term benefit, not much to be gained short-term. Definitely would not if you want to avoid having dryness and irritation. The chemical peels we mentioned, that's something you want to safely give a week or two, unless you've had experience using a certain chemical peel. Then yes, you do get some benefit even a few days before the event to kind of just have a nice bright look. But if it's your first time getting a chemical peel, you should give that 2, 3, 4 weeks to see how your skin recovers and how fast that might take. Because again, that depends on which chemicals used and which percentages are used for that and what the situation may be. And then I think another key thing, and I run into this a lot, is, and I make sure I ask about things, is, there's at an extreme lasers that are done. There's
mm,
lasers, but then there's lasers if somebody has a dark spot they don't want or a red spot they don't want. And it certainly can take care of those spots and look great in the end. But depending on your skin type and, certain nuances to that, there may be a recovery time. So for instance, with the red spots, when we zap it with the laser, sometimes they disappear and 2, 4 days later, you're looking good. It's gone. Some of them can turn darker though, and they actually look worse.
oh,
And you got to wait for it to fade away. And it's fine if it turns darker. But if you don't give it enough time, it may end up looking a little bit worse. And then some people's skin reacts differently. So some people have skin that's more sensitive or more prone to irritation. And so you might see a lot of redness after a procedure that might, be more than the normal. And so these are things to kind of anticipate. So lasers, again, unless we've had experience using them and we know what our recovery time is also something to give at least a couple of weeks or so of leeway.
okay. So don't do anything too radical or too
Right.
crazy unless you've done that before and you know.
Right.
Those are all great things to consider. And if you're looking for a chemical peel, you guys do them there, right at the office, right?
We can do chemical peels, and yeah, we do, several lasers as well. Yeah, just a good discussion. We usually have that's why we like to have, especially if it's our first time meeting, a consult visit to discuss these things. Just to have set reasonable expectations, goals, and talk about things of how much time you would need to recover, and when
Yeah.
would be the best time to have something done.
And if you need a whole skincare regime, you guys can sit down with somebody and figure that out for them and work
Absolutely.
through that. Yeah, that's
Absolutely.
important. I think I'm realizing more and more how important skincare is. I know we're talking about big events, but just overall,
Yeah,
skincare in general is so important.
absolutely.
All
Absolutely.
right. Well, you've given us all the things. I was taking notes. I hope everybody else was. But in case you didn't, you don't need notes. Just go see them. Harpeth Valley Dermatology guys are still taking new patients. Go check them out. All
Thank
right.
you.
Thanks. We'll see you soon. Bye, everybody.